Medical symposiums are always expensive. They bring together doctors, nurses and allied health professionals for a few days every year. It costs hundreds of thousands of kina, the money going to accommodation, transport, allowances and other costs. As the host province, Morobe contributed 50,000 kina to this year's event. But this morning the Deputy Prime Minister said the symposiums cost too much and they should be held every 2 years.
I call on the PNG Medical Society to consider the frequency of the annual Medical Symposium to once every 2 or 5 years.
Leo Dion says the medical profession's actions should reflect the government's year of implementation. There should be less talk and more action. He was particularly critical of poor performance of health workers throughout the country.
I've seen the lack of commitment by provincial-based staff. Sadly, this also affects the health workforce and undermines the dedication and commitment of the many that work in remote locations, often under very extreme and difficult conditions. I call on the Medical Society of this country to seriously address the declining work ethics of our esteemed health professionals.
The Deputy Prime Minister's comments comes 10 months after the passing of a 13 billion kina budget that saw 20% of the budget going to health. But while there is money going to the sector, it is a sector in crisis. Many of its staff are aging, the equipment is old, and the hospital management and boards are being investigated for corruption.
7 of our hospital boards in the country and their CEOs are under investigation for serious allegations of mismanagement. Health service delivery facilities are constantly running out of most of the basic drugs.
But there are positives. Last week, Angao Hospital in Leh reopened a refurbished emergency wing. The hospital will be reconstructed and new staff houses will be built. Scott Waide, National MTV News, Leh.